Hello class, my name is Roberto Santana and today I'd like to introduce you to a budding new clinical researcher by the name of Dr. Baguma Kabisa Titanji. For those of you unfamiliar with her, Dr. Titanji was born in Cameroon, attended the Royal College of Physicians where she received her MD, and recently received her PhD and MSc in Tropical Medicine and International Health at the University College of London. You can currently find her at the Emory University Hospital in Atlanta, working as a clinical researcher in the Department of Internal Medicine. Her research focuses on the cell-to-cell spread the cell-to-cell spread of the HIV-1 strain, as well as the antiretroviral drug resistance in HIV-positive populations, with a focus on sub-Saharan African communities. But today I don't want to focus on her research. What I want to talk about is ethics. Dr. Titanji realizes that the landscape of global research is changing, and as such, we need to keep ethics in mind when studying populations. Today, we tend to focus a lot of our clinical research on low-income countries. The reason for this is that low-income countries typically have higher incidence rates of diseases such as HIV, so it makes it a little easier to test the efficacy of our interventions given the larger sample size as well as the larger incidence rate. So Dr. Titanji has set forth several ethical guidelines to solve this problem of ethics and make sure we stay on track as far as that goes. The first of her guidelines is the need for proper informed consent. In many of these low-income countries, literacy rates are much lower than the United States, so we need to ensure that participants understand all their available options as well as what is being performed in the study. The second guideline is the need for the standard of care to fit the country. In the United States, we may have one standard of care for HIV treatment, but in Uganda, for example, the standard of care may be different there. So when selecting a control for a study, we need to ensure that our control is appropriate for the country and making sure that it is affordable, widely available, and known to the population as well. The third guideline is the need for independent and ethical review. Goes without saying, but we need to make sure that our review boards are independent of government as well as any company or research entities involved in the study. And finally, the last guideline that she sets forth is the need for accessible post-trial care. In one story Dr. Titanji tells a bit of a heart-wrenching story about a personal experience with a study participant after an HIV clinical trial. Unfortunately, this study participant was unable to continue HIV treatment for a 6-month period following the clinical trial, and as such, her condition continued to get worse and worse. However, Dr. Titanji was able to find a way to get this patient into proper treatment in her country, and everything turned out fine for her. But it made her realize that we need to take care of these people not just during the clinical study, but after as well, in order to remain ethical. So what I believe makes Dr. Titanji a leader here is that she knows exactly what her passion is, and she knows exactly where her role is in the clinical research realm. She knows that she wants to take care of people, and she knows that we have this responsibility to populations, especially in low-income countries. What also makes her a leader is that she implores us not only on a motivational level, but a bit of an emotional level to adhere to ethical standards and make sure that we are not failing to meet those standards, something that I believe is very crucial in a leader, having that high ethical code and ensuring that the rest of us follow along. So if you guys need any links to any of my sources, here you go. She has a wonderful TED Talk in which she outlines her ethical riddles in HIV research, as well as a wonderful interview that she did with People and Perspectives, where she talks a lot about her past and how she became involved in clinical research. So thank you very much, guys. I really appreciate you listening to my talk, and I hope you have a great day.